Welcome back. Listen Up is examining the U.S. healthcare debate, and Canada's largest ecumenical group of churches has weighed in on that. The Canadian Council of Churches says the U.S. needs a Canadian perspective for healthcare reform. And joining us is the Reverend Dr. Karen Hamilton, the General Secretary for the Council. Karen, thank you for being with us.
Yeah, it's a privilege, Lorna.
You've kind of helped us unpack the idea that Canada's system, which is a single-user, publicly administered fund, it was all a moral enterprise when Canadians embarked on that in the 60s. What do you mean, a moral enterprise?
Well, and I would say it goes back even further than the 60s in terms of being a moral enterprise. Healthcare, the caring for those in need, who are vulnerable, who are ailing, has been a tradition that goes back 2 millennia in the Christian tradition and is indeed a part of other faith traditions as well. In Canada, in 1639, the very first hospital was founded, and it was a hospital founded by a Christian tradition. It has always been part of our tradition that those who are vulnerable should be cared for.
Okay, what would it look like in activism? Because we've seen very colorful activism over this in the U.S.
We have, and again, I can't comment for the United States, but in terms of Canada, one of the very specific ways that it was made manifest was in 2002, when Roy Romano had his commission, and indeed it was the submission of the Canadian Council of Churches, which was the first one accepted by that commission, and what we talked about was a healthcare covenant. That healthcare is a covenant, and you know deeply and in the long-standing tradition of Christian theology that covenant, relationship, is one of our fundamental understandings of how we relate to God, how God relates to us. And so the healthcare covenant, and in fact I brought the document
and
with me.
We'll make it available on our website. It's a little book that you have to purchase, but it covers off everything from workers, how we relate to people, how we use this.
And how it is a covenant of all of those involved in the system working together for the common good, for the good of all people.
And you would argue that if you're going to be a follower of God, it is unavoidable that you get involved in healthcare reform.
Absolutely unavoidable. Now in Canada, we might talk about strengthening healthcare, and that's been a primary focus since 2002 for us, but it is unavoidable because we're called to minister.
But the dilemma seems to be Americans cannot agree on who pays for what and how they'll pay, and because there are ethical issues woven through the healthcare, embryonic stem cells, end-of-life care, abortion, how do they make their way through that and still sound like followers of Jesus?
Yeah, that's a really hard question. And again, I can't answer for the Americans. What I can say, though, in Canada is, again, what we did was put the person, put the vulnerable at the very top of the concern, and not the making of money, the making of profits, but looking at it as a common good. I said that before, as a common good principle, that healthcare is something that must be available to all, or else justice, what we would say in the Christian tradition, the kingdom, the reign of God, is not being proclaimed.
I think it's especially valid to bring the Christian view into the healthcare debate, because in every hospital room, every either celebration of life, crisis, death, passage, clergy is there, chaplaincy is called upon. I mean, they are there daily. What is it that the church has always historically brought to these matters of life in the most vital of healthcare issues?
The church, in its finest moments, has always brought the understanding that life is a gift from God, and that as clergy, as disciples of Christ, we are to walk with those who are traveling through whatever kind of valley of the shadow they're traveling through. That hasn't always meant advocacy, which in terms of a healthcare covenant is some of what we're talking about, but we have been called always to stand by those who need care, to care for them physically. So it goes back to what I said about the churches being foundational in terms of hospitals, but it's about life. Jesus was a healer, and he touched people in need who were suffering.
How fundamental was physical healing to the ministry of Jesus?
Oh, it was extremely fundamental. And it's something perhaps in some of our Christian traditions we don't talk about as much as we should. But he physically touched. He reached out, he touched lepers, which was something simply not done in that time and place, simply because there was not a clear understanding of the disease, and there are still lots of diseases in our time and place that there's not a clear understanding of. But it was woven all through his ministry, the physical care, the spiritual care, but the physical care was very much a part of who he was, and what he did.
All right, a gift from Canada into a very vibrant debate right now in the United States.
Debate indeed.
Reverend Dr. Karen Hamilton of the Canadian Council of Churches, thank you very much for being with us.
You're welcome.
And there's more to come when Listen Up returns. I'll share my thoughts on the healthcare war in the wrap.